Hi guys! Good morning, good afternoon, good evening, whenever you're watching this video. I just wanted to say hello, pop in. I miss you guys so much. I hope all is well. I'm praying for you and your families during this difficult time right now. I just wanted to go over briefly just a few things that we have going on at my facility, how people are handling things, treatment, and all that with this COVID-19. So let me start by saying, when we're coming into work now, everything changes every single day. Whether what proper PPE we're supposed to be wearing, what medications we're giving, treatment plans, and all of that. So as of right now, our proper PPE that we're going to be wearing when we go into the room is going to be an N95 mask, a surgical mask, a SWAT team helmet with a shield in front of it, our regular gown, gloves, and we have a head cover too, a bouffant. You know, I couldn't make this video without being goofy. Anyway, some people are wearing shoe covers as well. So before we walk in the room, that's what we're doing. We're gowning up and we're using those procedures for PPE. When we come out of the room, someone is to grab the helmet off of our head and clean it for us. We take everything off, we sanitize our gloves, and then we throw them in the trash. So a little bit different. So far, we have had so many COVID patients come into my facility, and as of today, 3 positive outcomes. We did use Rotoprone bed on all 3 of those patients, so I can say that that is beneficial for them, and we do see changes. If you did not know, I didn't before, I didn't know that there are only 5 Rotoprone beds in the state of Florida. Yes, 5. So what we were doing is calling and trying to see from different states if we can get put on the waiting list. And in the meantime, we were actually doing manual proning. So you would manually go in the room and flip these patients around. You're holding your ET tube, and we aren't using that Anchor Fast. The Hollister is the company that makes that. We aren't using that. So we're taking that off. We're manually taping the tube as good as you can. Some people wrap it around the neck, and we're flipping these patients, and we're turning them every 2 hours. So you can just like imagine what it's like for the RT to already be taking care of all these patients on the ICU units and having to go in and hold that ET tube in place while they're flipping this patient every 2 hours. So until we get the Rotoprone bed, that's what we're doing. These patients have pretty much been on the vent, PRVC, for approximately 2 weeks, maybe a little more. And so that's when we're starting to see progression in x-rays and blood gases and weaning them down from there. Now, please correct me if you can pronounce it any better. Hydroxychloroquine. We are using that medication. Our starting dose for what we're giving at our hospital is 400 milligrams. And so we're going to give that once a day. So we're also using the Zithromax, and we're giving them 500 milligrams a day, followed by 250 by IV. And that goes on for 4 days. So those are pretty much the 2 medications that we are using. What we're looking for when we're giving that Zithromax is we're closely monitoring the prolonged QT. So that is a side effect. We do need to watch out for that and monitor that all the time. Another thing that we're continuously monitoring is how the patient is doing when we're proning them. We don't want them to move. So you already got it, I'm sure. We're going to paralyze, but not only paralyze them, sedate them, right? We don't want somebody just paralyzed but not knocked out, not sedated. So we are giving them the Nimbex to paralyze them, as well as propofol to sedate them, put them to sleep, and so we can continue this treatment plan and get them better without any movements, that ET tube coming out. I'm sure that you get the point with that. Some interesting things that we are doing in the ER. My goodness, we are intubating people with a box over their head, with like a plastic trash bag over their head. We're not bagging patients anymore. We're leaving them on a ventilator during codes. We're using specific HEPA filters. We'll get into that when we talk about that on Zoom more specifically. But literally leaving them on the vent, not touching them at all, and letting the ventilator do the work, crank them up to 100% if they weren't already, and just standing back. We also have talked about when we're proning these patients, when we flip them to a supine position, one patient wasn't doing so well. So we even talked about doing compressions on their back, because if we flip them, he may just do worse. I am going to include some pictures, videos, all of that, a little bit of what's been going on in the hospital setting. Not everything that you see on the news is true. Some things are true. We are reusing the same N95 masks. We do put them in a paper bag. Some people have like a little McMuffin bag that they put them in. Just making jokes. We share memes, and make the most of it. I mean, that's really all that you can do. And I'll attach some pictures at the end of the video so you can see like what we're wearing as far as PPE, the typical setting, some pictures of disaster vents. I am also going to do a Zoom meeting, so I am going to post a date and time where we can talk about this like in more descriptive terms, so we can ask questions to each other. We can talk more about these medications and dosaging and side effects, and it just more detail of what's really going on in the hospital, how we're handling it, what the outcomes are, progression, and all of those things. So I'm here to answer any questions for you, and just please feel free to reach out, and I will schedule the Zoom meeting, and I look forward to talking to all of you. So I hope you're doing well. Stay safe. You know the drill. Wash your hands. Take care of yourself. Take care of your family. Check on everyone. Don't let this time period frustrate you and stress you out to the point where you're not staying focused and completing your end goal. Okay, so seniors, you're almost there. Freshmen, I know it's a bumpy start. I know you were just getting started in clinicals. We're going to figure it out. I'm here as a resource, but you need to utilize me. So most of you have my personal phone number. You have my email. Reach out. Let's get it done. Let's cross the finish line. Don't waste time complaining. Let's just get it done, okay? Utilize me as a resource. I have videos, all of that. We can do Zoom meetings, we can do phone calls, whatever you need, okay? Thank you guys. Thanks for tuning in. You know I should do my little rap. CPAP got your back, but no control attached. Make sure they all alert or your blood gas gonna be whack.